Hello, and welcome to another podcast episode of Overpowering Emotions, where I talk all things big emotions, emotion regulation. I have a wonderful guest today, Dr. Shahrzad Jalali. She's a licensed clinical psychologist specializing in trauma resolution, relational dynamics, and somatic healing. With a unique approach that blends psychoanalysis, depth psychology, and body-centered therapies, she helps people uncover and heal silent trauma, emotional wounds that often go unrecognized but deeply impact well-being. And that's what we're going to be talking about today is some of this silent trauma. And she's got lots of tips and tricks and things to think about. Hope you enjoy. Well, Dr. Jalali, thank you so much for coming on the show today.
Thank you for having me. It's a pleasure to be here.
Why don't we start off by having you introduce yourself a little bit to the listeners?
Sure, I am a clinical psychologist specializing in trauma work as well as couples and sex therapy located in Newport Beach, California. I run a couple of private practices and um, do a lot of work in mental health, and it's a passion of mine as well as obviously my career, and I'm glad to be partaking in this process.
Yeah, it's great having you. And I love the topic that we're going to be talking about today, just looking at silent trauma. So I'm wondering if we can start there, if you can define silent trauma and how that differentiates from other sources of trauma that we consider.
So when we use the word silent, we're mainly referring to the trauma that people have experienced, but do not necessarily identify as a traumatic event. Usually, if someone as an adult is engaged in any kind of experience that results in some form of scarring or pain or hurting, they identify with it as a traumatic experience. But particularly what we go through in the first stage of life, between the age of basically after we're born till 6, 7 years old, a lot of us potentially don't have a lot of memory of it, but it does impact us in many different ways. And some of these silent traumas are mainly rooted in those initial years of development where we are adapting um, mindsets, behaviors, beliefs that actually works against us. And in psychological realm, I guess we refer to that as silent trauma because it's not as active in one's conscious mind, and not categorized as a traumatic experience.
Okay. Which would make it tricky, I suppose. How would you identify if a kiddo or an adult even had sort of these unconscious things going on for them?
Correct. Now, I have to admit, it's not just in childhood that we experience silent trauma. I often work with many adults that go through traumatic experiences that they override. So there's this word in psychology that we use a lot in regards to emotions. We say, I override my emotions in order to be able to tolerate them, right? So I tell myself, it wasn't that bad. I'm okay. I'll be okay, which is fine. It's a coping mechanism. We need to use it to survive life. But at the same time, we have to make room to process that emotion that we're trying to override. A lot of times, I speak to many adults that go through experiences that are scarring for them, but they don't even want to admit to themselves that this is a tough experience. So essentially, they don't even like to have the word trauma associated with it because many people maybe conceptualize this word as weak or failure or many other connotations that resonate with them in this regard. However, I think it's important to give something a name because that's where healing starts when we admit to ourselves that this is a tough process that I'm dealing with, or it hasn't been easy for me to process it or sit with it or bring awareness to it, even.
And I'm just actually thinking about we know responses can be very different to a similar situation. One event that's traumatic for one person might not be traumatic for another. Is there a way of being able to tell what has been traumatic for an individual, especially maybe with some of the silent trauma, differentiating just a bad negative experience versus something that actually was traumatizing?
Yes. So we say when, let's say, I'm going to use the example of car accidents. We say if three people are in a car accident, usually I'm talking about a fairly difficult one. One out of three will develop some form of PTSD, post-traumatic stress disorders, around the essential accident. And now, what makes the other two not have this association with it, and one person have it? This is a very complicated question to answer. For the most part, I think it's tied to our resiliency and our capacity. Now, even within one person, this changes throughout life, depending on what's happening with you, what you're going through, what your resources are. But situations are happening every day. We go through different events every day. For the most part, I think we have the capacity to respond to them. That doesn't mean they haven't impacted us. But when they turn into something that linger, when they turn into something that shifts our worldview, shifts our behavior, shifts our responses more from actual responses to reactions, I would say that's a good indication that the situation has impacted us on a deeper level. And that is not necessarily a bad thing. I guess my hope for this conversation is to change the connotation around the word trauma, because people think if they've had trauma, it's a bad thing. I don't think any individual ever survives life without traumatic experiences, at least, right? Maybe not a big T, but a lot of small T's. So, what we want to do with that is we want to just give ourselves some room to process it properly so it doesn't dominate our everyday life. That's the only goal. The goal isn't to say we're broken or there's something wrong with us. It's just something that happens as we go through life, kind of like, a child is born and the first time they fall down, they may get a scar. And as they go through life, this happens repeatedly. And it hardly ever happens that someone turns into an adult without having some form of, a broken bone or a scar or something that has happened to them throughout this process. The same is true for our emotional realm, I suppose.
I love that you talk about sort of reframing this trauma. When we look at the definition of resilience, it's about having some adversity, trauma, significant sources of stress in your life. And so we need to have these experiences in our life to become resilient. And you said the goal is to process. So I imagine naming it is one part of that process. And
Yeah.
how would you name it? What would someone name it?
What would come next? Well, depending on what you are experiencing or what you're feeling, I would say the first step is to just allow yourself to notice that, because a lot of times these things exist in our realm of being, but we're completely unaware of them. I mean, we just feel like, well, this is how I'm supposed to be feeling, or this is how life is. So just making some room to letting what is there emerge and noticing it. For the most part, we do this on a visceral level in the body because the body is more accessible to us than the brain is. So, or I should say, the mind is. So, if we just allow ourselves to kind of bring some attention to whatever is happening with us at this moment, right? And it usually shows up for many people, if it's a negative emotion, let's say, as a form of discomfort. Like they may say something like, I feel I have butterflies in my stomach, or my heart is pounding faster than it usually does, or I feel like I'm having difficulty catching my breath, for example, right? And then you trace that back. So you say, okay, so that is the sensation you're experiencing right now in the body. Is that associated with any kind of feeling? And for the most part, people have a lot of difficulty naming feelings because if you have noticed, most of us just suffice to good or bad when we want to describe what's happening with us. So it takes a little bit of understanding, differentiating between different feelings, but eventually people can associate a visceral experience with a feeling, and then from there we want to connect it to a thought. So is there a thought that happens, or maybe a series of thoughts at this moment when you're feeling like you have butterflies in your stomach and you are relating to that feeling as anxiety? And maybe the person says, yes, I'm thinking about this task that I have to get done over the next hour, right? And then you put all of that together, and that creates a new language for the person to kind of be able to identify and speak from. Eventually, we connect it to many other things like memories in regards to trauma, or sometimes we go to people's dreams, fantasies, depending on what we're dealing with.
Would that process be the same whether adult or children? Or is there anything you would do differently for children?
Well, with children, you have to remember, as adults, for the most part, I want to say, we have more words to be able to express ourselves. With children, we like to keep it to mainly activities that allow them to maybe play or act out something or draw or bring some level of right brain processing to whatever it is that they are experiencing. They may not necessarily, depending on their age, have the right words to express something, but emotions aren't just expressed through words. There are multiple ways of processing them.
Okay. Okay, that's helpful. And then once they're able to identify and sort of add language to it and talk through it, is that enough for the process, to help process that trauma, or are there more steps?
So that's a great question. Talk therapy, but by itself is not sufficient. In fact, back in the day, we started to notice this when people would come back from war and had PTSD symptoms or had trauma associated with their experience. And they would go to therapy and they would talk about this over and over and over again. Come to find out, not only they didn't feel better, but sometimes they ended up feeling worse because they just kept on re-traumatizing themselves about a particular event that was unpleasant, obviously. So the goal is for the body to go through that process without having the initial reaction it had to the process. Let's say in the moment that I am about to have a car accident, I go into a state of hypervigilance, my body becomes super escalated, and I feel a sense of fear, distress, all those emotional experiences. Now, if I speak of that incident with that same level of escalation in my body, essentially what's happening is I am continuing to re traumatize my system. So, what has to happen is for me to be able to recall that experience mentally without having the same level of escalation in my body. So, the goal of the clinician who's treating the patient is to keep their body in a state of essentially normal level of escalation while they are speaking of that event. So they get to experience it on a different level. That, yes, I get to remember this, but with ease, not necessarily with pain. And that changes the narrative in our mindset and obviously our visceral experience about it. So allowing our nervous system to not become as reactive to it.
Right. It's teaching that amygdala, that emotional brain that, hey, everything is okay. So how would you do that? How would you guide them to be able to recall and talk about these events in a calmer sort of state?
One of the initial ways they started to do it is through medication. So they administer medication that keeps the body, at a level of ease while you recall the trauma. Um, it's a great way of doing it. However, I am a big advocate of trying your own body resources prior to resorting to anything like that. So I like to teach my patients about their body and the experiences they're feeling in their body and guiding them to use their own wisdom to calm themselves down. So let's say they start to talk about something and you realize that they are having difficulty catching their breath, or they're becoming teary-eyed, or their body starts to display levels of anxiety. So you stop the storyline and you kind of navigate that experience with them, allowing them to use their own resources, which either you have taught them or they have learned over the years to kind of calm their body down. And once they reach a level where they're feeling more contained, they continue with the storyline. So the goal is to go through the storyline without the level of escalation that they were processing before.
Right. I like pendulation, and grounding. I find that that can be really helpful, and even just like being able to go back and forth from the body part that's maybe holding some of the stress down to the feet, where we can kind of feel that grounding. I personally don't do much breathing, but I don't know what strategies you find most helpful when you work with clients.
I agree that not everyone responds to the same strategy necessarily well. This is why psychotherapy is such a personalized process. There's so many techniques for grounding. There are so many ways of dealing with the body, like you pointed out, pendulation, titration. So I try to kind of give people as much of a package prior to starting this process as they possibly can, and then have them practice it on their nervous system to see which ones they respond to better. At times, some may have a better reaction than others, depending on what's happening and what state of mind you're in. I'm a big advocate of creating a lot of comfort for the space, for the body. And then eventually, I believe that the body just finds its own wisdom and follows that. But initially, you obviously have to be guided into the process.
And what would some of those tools or items in that package be?
I would say one of the easiest way to start is with the five senses. So anything that can help the person going through this process ground themselves through a sense, because they're always with you and they're accessible. So the goal of this is to eventually make them independent enough to be able to do this on their own, as is emotional escalations show up for them in their everyday life. And with the five senses, you can always ground yourself just by picking an object to um, look at and describe for yourself in as many detail as possible. Maybe listening to some bilateral tunes or whatever noises or sounds are around you. One of the fastest acting senses is actually smell, because it doesn't go through the relay station of thalamus. So for people who have an escalated nervous system, or I should also admit, an under-escalated nervous system as well, because they can both be problematic. I would suggest carrying senses that can help them kind of calm themselves or de-escalate in the moment. Obviously, touch is a big one. We always have access to something, whether it's the clothing we're wearing or the couch we're sitting on. So, just going to the basics, I think, is the best place to start, because people can relate to it and then eventually they figure out the wisdom of their own body and they realize which one works best for them. And the more you practice this, the more your brain will go there quicker next time you're in that situation, kind of like learning to play the piano. You'll just develop more pathways to get there quicker, essentially.
Right. Yeah, this is very helpful. I mean, I usually work with um, kiddos who we're not processing past events. It's more like the anticipation of things to come, the anxiety that comes up with things to come. Would you use these strategies in those, like do an exposure therapy, for example, and use some of these strategies?
Absolutely. I think the goal of it all is to give them the sense that you are capable of tolerating this, right? So, both the past and the future, what causes distress is I cannot tolerate. So, whatever that has happened to me in the past is too much for me to bear, or whatever is going to be happening in the future is going to be too difficult for me to be able to handle. So, what we're doing in that moment is giving the person the capacity that to endure that dynamic, whatever it may be, and getting them to the belief system that I am resourceful enough to be able to handle this dynamic. Now, the more they can tap into their resources, the more they will feel capable in that regard. So, absolutely, it doesn't matter how you
Yeah.
go about it.
And that's my focus. I mean, it's all about the learning that happens, right? If we do an exposure, it's not just doing the exposure, it's about what did you learn here? And for me, it really is about, even if my physiological arousal is elevated, I can still manage it and tolerate it and keep my prefrontal cortex online. So
Mhm.
I'll give them pendulation exercises, but the goal for me when I'm doing those are isn't necessarily to calm them down, because we can't guarantee that outcome. So it's just being able to keep the prefrontal cortex online, staying with the body, noticing it, even if it's getting elevated, but still knowing that they can tolerate it. So that's kind of a big piece of the work that I know I do.
That's a very good point. Whenever we're able to stay present with an emotion, we learn that we can allow it to pass, whatever it may be. The problem with our emotional states that cause distress for us is we get caught in interpreting them or fearing them or needing to overcome them, right? But there is no goal in emotional processing other than being present in the emotion. Once we're present in the emotion, we usually can find our way around it. And that's exactly what you were describing.
Right. I love that. I love that. Anything else, just in terms of the silent trauma that we haven't touched on that you think is important to make sure we do?
Nothing that's coming to me in particular. I just think it's important to bring awareness to it and for people to maybe take an inventory. I love the idea of doing a timeline of what you remember of your life, your upbringing. Sometimes I have my clients look at their baby pictures because when I ask them about their upbringing or their developmental years, they say, no, everything was very normal, very good. And I'm sure it was. This is not to say we're trying to find a flaw in your upbringing. Um, it just means that we all have suppressed a lot of emotions that it would benefit us to process them. Otherwise, they're going to run the show of our lives, essentially.
And yeah, absolutely. I guess my last question is maybe more forward movement. Once we're able to process maybe past events, anything that you recommend for clients to build their resilience from there? Not sure if you do anything specific, but
See, this is a very broad question to me. There are many things we can do to build resilience, obviously. But the most important thing that comes to my mind is our sense of self. So, Our sense of self describes a capacity to us. And we all identify with a particular capacity, the way we've come to recognize ourselves. When something causes stress for us, it means that we deem that our capacity is less than that dynamic, that event, whatever it is that we have identified. The goal is to allow a person to become bigger than that problem. So, to increase their capacity. Now, what that looks like at any moment, obviously, you work with kids, it depends on your age, on your just, I would say, even genetics, on your resiliency, on how much essentially inner work you've done. So it can come in many different shapes or forms. But the most important thing is to, I would say, sit with that process and try to find resources that increase your capacity in that moment so that problem just becomes part of you or what you're dealing with versus you in your entirety. Once we can see it that way, we develop enough perspective with it to be able to problem solve it, both on
Amazing.
an emotional as well as a, kind of cognitive level.
Right. Yeah. Well, thank you so much. This has been really helpful. Lots of good information and tips for
You
people to take up. I will have all of your information in the show notes, but for the people who are listening right now, where's the very best place to find you if they wanted to look you up?
absolutely. Thank you for asking. I have a couple of social media handles that I'm sure you have and you will share with your listeners. I do some informational videos on there. The English one is Align Remedy. They can find me under Align Remedy. I also have a book coming out in September called The Fire That Makes Us. It's a transformative kind of process for dealing with trauma and learning how to grow from it and kind of turn it into our advantage versus limitation. So very excited about that. And our websites are available for the listeners, Dr. Jalali and Associates, and Align Remedy, which is the private practices I referred to, or accessible in all those domains.
Amazing. Well, how exciting. Good luck with your book. Congratulations.
I appreciate it.
And yeah, thank you so much for being on the show.
Thank you for having me.